Thank you, Mr. Chairman. I don't think either party has all the best ideas, and both parties have solutions for health care. I wanted to share a personal story of mine. I think most of you know when I was first elected to Congress, I was still single. Since then, I got married, and I had a little baby 2 years ago, Cole. And my husband is retired from the Navy, so he has TRICARE, and as a member of Congress, I've selected the Blue Cross Blue Shield. When Cole was born, we thought, well, we'll put him on TRICARE because, quite honestly, it was cheaper, okay? That lasted for about 6 months because my son has special needs, and we set him up with a pediatrician, and it was important to me that he be able to see the same pediatrician every time that we had a checkup. And when I called for a 6-month checkup, I was told, oh, you know what, Dr. LeBeau doesn't have anything available. And I said, well, what if we wait a month? Well, sorry, he doesn't have anything available then. Well, when would he have something available? And I was told, you'll actually have to see a different pediatrician. And I said, well, my son has special needs, really would like for him to stay with the pediatrician that he already knows. Told sorry. So what did I do? I called Dr. LeBeau directly, and I get an appointment. But you know what? That doesn't happen for everyone. And so now I have my son on Blue Cross Blue Shield. Another interesting point is that, at least in D.C., there was no one. There was not a physical therapist, there was not a speech therapist, there was not an occupational therapist that would take TRICARE. And I guess what concerns me about the proposal that's in front of us is that I do not believe that it's addressing the cost drivers within the system. It is proposing to spend an additional $1 trillion, and we're already spending $2.5 trillion every year on health care, and we're going to throw another $1 trillion at it, and it doesn't provide more options for everyone. It sounds good that, yes, under TRICARE, under the VA, veterans and the military have health care. But what kind of health care do they get? It sounds good that anyone in Medicare, our seniors, have health care. Medicaid, the low income, the developmentally disabled have health care. But the kicker in it is that the government doesn't pay the cost. And so what happens? We've seen the results. We see where it is difficult to find providers that will take Medicare, will take Medicaid, will take TRICARE. We've seen where these are in our rural hospitals, where it is harder and harder for them to balance because they have a higher percentage of Medicare and Medicaid. And what does it do? It puts more shift to the private sector. So to think that we're going to pass a bill that's actually going to be more costly, $1 trillion more dollars, reduce options at a time when we need more options in our system just doesn't make sense to me. It's estimated that this bill will result in 2 out of 3 Americans losing their current health coverage. That's the Lewin Group, 2009. 114 million Americans are going to be forced out of their current private health insurance option. What Congress needs to be doing is looking at providing more options to Americans. That is what Americans want to have, and that's what we have been a part of proposing, whether it was the individual market, the group market for small businesses. We need to be providing more options, not less options, and we should not be passing legislation that's actually going to reduce access to more of these options, actually causing people to lose their coverage and ultimately their jobs. And I yield back.
Gentlewoman yields back.